Hi, I'm Dr. Janet Beeler-Marfisi, and I'm a researcher in respiratory health or lung health of horses. I study diseases like mild equine asthma, which you will also remember is called inflammatory airway disease, and I look at exercise-induced pulmonary hemorrhage or bleeding. We will be talking about the respiratory tract of horses together. We can split the respiratory tract into the upper respiratory tract, which is the voice box up to the nostrils, and we can talk about the lower respiratory tract, which is voice box down to lungs. We will be talking about the upper respiratory tract now, and we will talk about the lungs later. So we have here in front of us a specimen, and I will just take a moment to orient you to that specimen. All of you will be able to recognize the brain, some structures that you may not recognize. The nose was here. We have the nasal passageways here. This is the hard palate. We also have the tongue of the horse, which has been cut in order to see some other important structures. Before we start talking about the respiratory tract, though, I just wanted to talk about breathing, or actually ask a couple of questions of you about breathing. So the first question is, why do we breathe? Yeah, you're right. We breathe because our bodies need oxygen from the air in order to allow our muscles to function and our organs to function. So the second question is, how do we breathe? Yeah, take a breath in. It goes in through the nose, down through the windpipe and into our lungs. The other way we can breathe is through our mouths, right? We can take a breath in through our mouth. It goes down through the windpipe and into our lungs. And at the end of the lung is a structure called the air sac. So at the end of the lung, there's the air sac, and that is where oxygen goes into the body. And the oxygen goes into your red blood cells, and your red blood cell is now taking that oxygen that you just breathed in and is taking it to your muscles so that they can do work, or to your organs so that they can work for you too. Take another breath in, and then do a couple of bicep curls. So that oxygen that you just breathed in went into a red blood cell, went to that muscle, and allowed it to do the work. When the muscle did that work, it made carbon dioxide. So carbon dioxide went out the other side of the muscle and into the veins. And the veins brought that carbon dioxide to your lungs. And the carbon dioxide is what you breathe out when you're breathing out. You breathe in the oxygen, and you breathe out the carbon dioxide. And that's exactly what horses do. The thing about horses is, though, they can only breathe through their nose. We can breathe through our mouths, horses can't. And that's because of their system of having their epiglottis sitting over top of their soft palate. Some of you will be asking, what about yawning? I've seen my horse yawn. Well, the fact is, nobody actually knows why horses yawn. They think it might be to release jaw tension when we take off the bridle, for example, or when they're in pain, like when they're colicking, they might do this yawning behavior. And they might also do it when they're in stressful situations. But the fact is that if you watch them, you'll see they're not actually breathing when they're doing that. They're just opening their jaw. They stick out their tongue. They look like they're taking a breath just like we do when we yawn, but in fact, they're not. Now let's talk about how horses breathe. The air comes in through the nostril over here, and then it can go through several passageways in the nose, but the one it takes most is the bottom passageway, and that's the one that you'll recognize from your own horse being scoped. That's that pink tube that you see at the beginning when the vet first puts the scope in the nose, and it doesn't look like too much. And then when you recall having seen a horse scoped, you'll get to this structure here, which is the soft palate. The soft palate is a movable structure. When the horse is running, however, or whether they're trotting or pacing at full tilt or even just jogging, that's held taut. It's held straight by all of the muscles inside of this area, which is called the pharynx. And that keeps it so that the air has a smooth passage through here with as little resistance as possible over the epiglottis, which is right here, past the arytenoid cartilage, and down through the windpipe and to the lungs. The next structure, which I know you're all familiar with, is the epiglottis, and we have that right here. We can see that it sits on top of the soft palate. And that's what permits them to breathe, because the epiglottis is the entryway to the windpipe. And then these two structures here, which are the arytenoid cartilages, those are in place and they open and close as the horse breathes. If the horse is breathing at a gallop or at a trot or a full pace, they will open wider to allow, again, maximal and smooth airflow through the entire system and down into the trachea. Another structure that you may or may not have seen when the vet has been scoping your horse is this one that's hiding right here. This is the guttural pouch opening. It's a slit-like structure that opens with a bit of cartilage, and you may have seen the vet look in there with a scope too, because of course horses can get infections of various kinds in there. Might be fungal infection, might be bacterial. That's breathing. How about when they're eating or drinking? The arytenoids move down, the epiglottis tilts backwards, and the soft palate moves up, which makes a smooth platform for the food or water to go from the mouth down here and over to the esophagus, which is over here, the left side of the horse. So you'll remember that when the horse is being scoped, your vet gets upset a little bit if the horse starts swallowing too much, because that way they can't get into the windpipe as easily to look at the lungs. But on the other hand, they do want the horse to swallow when they're introducing the stomach tube, so they can get that crossover action and get the stomach tube down into the stomach rather than into the lungs. Okay, so when the horse swallows, and you can feel this on yourself, you put your hand on your voice box, and when you swallow, your voice box goes up and then comes down. The same thing happens to the horse, and you can watch that. When you watch them drink after a race, you watch how many times their voice box goes up and down to count the swallows. Let's talk about breathing. Problems that can occur are if those tubes get smaller for any reason. So one way that tubes can get smaller is if we have a horse with nostrils that don't flare anymore. We've all seen the horse that has a lazy nostril or some problem there, they've been cut or something like that, and they don't function quite right. Well, that does pose a problem because it makes the passageway narrower. So you can demonstrate this on yourself. Take a breath in with your nostril flared and feel how that feels. It's like the air comes in and it's just great. Now take your fingers and slightly press on your nostrils and try and breathe in that way. Many of us will have had a sensation that was harder to breathe. And the same is true of the horse with a problem with its nostrils. It's harder to breathe because we've made the diameter of that tube smaller. The next part that can go wrong is that breathing passage. So if anybody has allergies that affect their nose, anybody ever had a cold? We all know that horses get colds too, and they get mucus in their nose. Well, just like us, when they get mucus in their nose and have a cold or something, or allergies, the diameter of those tubes, of that ventral or that bottom passageway, will become narrower, and that will restrict the flow of air through that passageway and make it harder to breathe, so the horse can't perform as well. The next thing that can go wrong is that the soft palate has problems with it. It can become flappy if there's damage to the nerves that supply those muscles that would normally keep it under tension, or we can have problems where the epiglottis slips underneath, and then we have so-called dorsal displacement of the soft palate. I know we've all encountered horses that do that. Another problem that can occur is that we have problems with the epiglottis itself. It can be malformed, or it can become entrapped, or we can have inflammation around that structure. And then the next problem that can occur are problems with the arytenoid cartilages. So those can become inflamed, just like the tissue in the nose. Those can become inflamed, or if we have damage to, say, the left recurrent laryngeal nerve, one of them can become sloppy. It might not move out of the way as much. You'll have seen that on some of your horses, that one of them might not move out to the side as much as the other. And then that too causes a narrowing of that tube and increases resistance to the work of breathing for the horse.